Welcome to the ReAD Help Video 4.5. This video focuses on providing additional information for considering the head-to-head cost-benefit of the options being considered in the context of an unchanged budget. My name is Terry Haines. When assessing the head-to-head cost-benefit of different options being considered using the ReAD, you'll be asked to consider the ideal circumstances situation based on the research evidence. You'll be asked, in your best judgment, what is the comparative cost-benefit of both the existing and proposed options for your community and health service? You'll be given response options where you can say that the existing is much more cost-beneficial, somewhat more cost-beneficial, whether the existing and proposed options are comparable, whether the proposed is somewhat more cost-beneficial or much more cost-beneficial. To answer this question, ideally there would be research available that has conducted a head-to-head comparison of the options that you're considering. This can happen when the options being considered address the same problem. For example, this particular study examined 3 different approaches to trying to reduce chronic lower back pain using physiotherapy. It was a randomized controlled trial with an economic evaluation at the same time that revealed what the quality adjusted life years gained with each of the different treatment approaches was. But this may not always be the case. Often there are studies comparing one option to a control and a separate study comparing the other option to a control. These studies may not have used the same model of economic evaluation, so will express the result in different ways. Meta-analysis is therefore unlikely to be able to be useful for combining the results across multiple economic evaluations. Making this assessment may mean that you have to rely on your interpretation of the evidence from the economic evaluations that are available. In terms of expressing benefit, there are many different models of economic evaluation. You may come across cost effectiveness, cost utility, cost minimization, and cost benefit analyses. Having multiple studies that use these different terminologies means that you cannot directly compare the results from one study to another. The degree of benefit, though, either being much more cost beneficial or somewhat more beneficial, will also require you to rely on your judgment. To make this job easier, what I would suggest that you do is consider the magnitude of the effect in the clinical outcome, whether that be quality adjusted life years gained or improvement in a particular clinical outcome, and the magnitude of effect for the cost outcome separately. If you save thousands and thousands of dollars per patient and you have a small improvement in your clinical outcome, that might indicate somewhat cost effective or a much more cost effective option, depending on how important those dollar figure and clinical amounts are in the context of your consideration.